Hi, this is Dr. Christy from Body Bar MD, and we're going to talk about sex today. Let's talk about sex, baby. This is it's one of those topics that is, everybody's talking about it when they're out at the pool parties or they're with their friends, they're on vacation. But unfortunately, it isn't something that gets talked about a lot. And it's just this whole concept of what I call sexual health or sexual wellness. What we know in kind of the functional medicine world is that intimacy and sex are a huge part of our relationships and our intimacy as mammals. And it has a significant impact on how we feel about ourselves, on our mood, even on our cortisol levels and our inflammation. So it is important. It's not just, it's all about sex. It plays a really important role, and it plays an important role throughout our lifetimes. There's no age limit on sex. And unfortunately, one of the things that starts to happen when women are kind of perimenopausal or postmenopausal, they may start experiencing vaginal dryness, total lack of libido. Like, some women will say, if I had a choice between doing the laundry and mowing the lawn, and having sex, I'd rather mow the lawn. It just isn't on their radar screen at all. Sometimes it can go so far as it actually hurts, what we call dyspareunia. So it's painful intercourse. And this is a two-way street. The female is experiencing these symptoms, but so is their partner. Not necessarily in the physical way, but a loving partner is going to have some feelings on that. Many men will say they don't want to harm their partner. They don't want to hurt them. There starts to be a little bit of this pulling in both directions where at the same time that women tend to go through menopause, men may be experiencing andropause. So their energy levels aren't as good. They need more sleep. They may be experiencing what we call erectile dissatisfaction. So they can get an erection, but it's not as hard as it used to be. It doesn't last as long as it used to be. And that starts to affect them as well. And then you get this kind of going both ways where maybe the woman doesn't feel like, one partner doesn't feel like having sex, or there's some dryness issues or pain issues. The male is experiencing some issues, and then it even starts to spiral into this. They touch you and there's this pull away, and each partner starts to think that it's them, that they're responsible for it, that their partner doesn't love them anymore or want to have sex with them anymore. And it just can be this kind of mess when it comes to sexual intimacy. And it's something that we're not afraid to talk about here. We understand that on both sides of the thing, on both sides of the spectrum. So, we have to address all of the issues that go into that. Certainly there are emotional issues and there might be psychological issues, but sometimes it really it's a physical thing, and there are things that we can do to help with that. So on the female side, as I've discussed before, getting your hormones balanced, feeling better in that regard, doing things like the O-shot, which can improve vaginal lubrication, sensation, climax, all of those things. On the male side, same thing. It's going to be testosterone. It can be what's called shockwave therapy, which can actually help to increase and create new blood flow within the penis. And then same thing, we add PRP into this area that now has new blood flow. And as you can imagine, an erection is all about blood flow. So if we can increase the blood flow to that area, men are also going to experience an improved erection, longer duration, and better sensation. We can add to that even more with even things like what we call it's a penis pump, which actually can increase length and girth in combination with these other things. It's not a necessary part, But again, these are some of the things that people are experiencing that maybe they don't want to talk about. Erectile dysfunction is actually by age. At 40% of men are experiencing some form of erectile dysfunction. By age 50, it's 50% of men. By age 60, it's 60% of men. So this is not a minority of men by any means. So it isn't something that you need to be embarrassed about. It isn't something that you have to do on your own. This has really kind of become something that we specialize in for both men and women. And yes, it goes together. One patient getting treated helps the other. It's also not uncommon to see one partner coming to see us and then the other one comes in and says, I'll have what they're having. So, this is something I just want to encourage anyone who is experiencing these kind of symptoms. This doesn't have to be treated with a pill that's going to make you feel worse. You don't need to be embarrassed about this. It is very common. It is very treatable, and we can get your sex life back to where you want it to be, so that it's something that you and your partner can experience for the duration of your relationship. If you have any questions, please check us out at bodybarmd.com.